Hello and welcome to UMCC Medical Consultants Connectors. We are so glad you have joined us today because your health and the health of your family truly matters to us. Join our growing community for clear, accessible health information. Subscribe to our channel. If you find this guide helpful, share it with others who might benefit. A simple click can connect someone with knowledge they need. Deep inside, high in the throat just behind the nose, the adenoids sit. Small, specialized lymph tissues, a bit like tonsils. The first line of defense for young children. In babies and young children, these tissues are crucial, trapping germs, viruses, and bacteria entering through the nose. They sample these invaders and help the body build a library of antibodies. That trains the immune system for future battles, vital during early childhood when exposure to new pathogens is constant. As a child grows, the immune system matures, develops more sophisticated defenses, and adenoids become less critical. They naturally shrink, often barely noticeable by the teenage years and adulthood. But for some children, the process doesn't go smoothly. Adenoids can become persistently swollen or enlarged from repeated infections or from allergies. When that happens, these guardians can become chronic problems, obstructing airflow, creating a cascade of health issues, impacting a child's quality of life, disrupting comfort, and even affecting development. This guide is your clear 5-minute roadmap to understanding this common childhood condition. We'll walk you through the process, identifying the initial signs, including often subtle ones, how doctors diagnose the issue, and the range of effective treatments available today. Our goal: empower parents and caregivers to recognize symptoms, ask the right questions, and confidently navigate toward a solution. Your child's comfort and healthy development are paramount. When you bring your child to a doctor with concerns about these symptoms, the diagnostic process begins with a thorough conversation. Your physician will want to build a detailed picture of your child's health, so be prepared to answer specific questions. They will ask about the frequency and severity of the snoring, whether you have witnessed pauses in breathing during sleep, how often your child suffers from ear infections, how often your child suffers from a runny nose. They will also inquire about your child's daytime energy levels, their performance in school, and any behavioral changes you may have noticed. This detailed history is often the most critical piece of the diagnostic puzzle. Following the discussion, the doctor will perform a physical examination. However, directly visualizing the adenoids can be challenging because of their location. A simple look into the mouth will show the tonsils, but the adenoids are hidden higher up behind the soft palate. In some cases, a physician might use a small, long-handled mirror placed at the back of the throat to try and get a glimpse. For many young children, this method can be difficult and may not provide a clear view. The doctor will also examine the ears for signs of fluid buildup and check the neck for any swollen lymph nodes, piecing together the physical evidence. To get a definitive look at the adenoids, the most common and effective tool is a nasal endoscopy. This procedure sounds more intimidating than it actually is. A pediatric otolaryngologist, or ENT specialist, will use a very thin, flexible tube with a tiny camera and light on the end. After possibly applying a numbing spray to make the experience more comfortable, the endoscope is gently guided into one of the nostrils. It provides a clear, real-time image of the nasal passages and the adenoids on a video monitor, allowing the doctor to directly assess their size and the degree of obstruction they are causing. This test is quick and provides invaluable information. In certain situations, additional tests may be recommended to complete the clinical picture. An X-ray of the side of the head and neck, known as a lateral neck X-ray, can create a silhouette image that shows the size of the adenoid tissue in relation to the airway. If there are significant concerns about hearing loss due to recurrent ear infections, a formal hearing test, an audiogram, may be ordered. For children with suspected sleep apnea, a sleep study, or polysomnogram might be necessary. This overnight test monitors brain waves, heart rate, breathing patterns, and oxygen levels to precisely diagnose the severity of sleep-disordered breathing and guide the most appropriate treatment decisions. The approach to treating enlarged adenoids typically follows a step-by-step progression, starting with the least invasive options. For many children, especially those with mild symptoms, conservative management is the first line of defense. This can include a simple over-the-counter saline nasal spray or a saline rinse to help clear mucus. These help reduce inflammation and make breathing more comfortable. If allergies are suspected, the doctor may recommend an antihistamine to manage the allergic response and reduce swelling in the adenoid tissue. If symptoms persist beyond these measures,